Hi everybody, my name is Lulu Achua. I am going to be talking about the care for a drain, either the Hemovac drain or the Jackson Pratt drain. I do not have an actual patient or a stuffed animal, so I am just going to be doing the explanation. I am sorry I'm making this video late past due. It's because I had a cold and my voice was gone. You can actually still feel that my voice is still not okay. I'm using some force to break it out. But without much ado, let me start. First of all, before caring for a drain, I have to verify the order to be sure of what I am going to do. I confirm with the provider's order. After verification, I get into my patient's room, knock at the door, introduce myself to my patient, and provide privacy. I explain to my patient what I am about to do to them or for them, and then I wash my hands, hand hygiene. Wash my hands, then put my equipment in order, gather my equipment. After gathering my equipment, before I start with the patient's drain, I have to carry out the two forms of identifiers to identify the patient, to make sure I'm working with the right patient. And I have to check with their name band and ask them to identify, like, what's your name? Please, can I get your first and last name and date of birth? So I then, while the person is telling me, I verify with their name band. And after that is done, I assist the patient to a comfortable position where it will be easy to access, for me to access the drain and make it comfortable for them to help while I'm providing the drain. Using a sterile technique is very important in drain care. Um, um, I place a granulated collection container under the drain outlet so that whatever content is coming out, the outlet pulls off, is being contained into the container, and the device should remain compressed. I carefully, after that is done, I secure the HVAC or in the drain, the patient's gown below the wound, and then I make sure I carefully measure and record the character, color, the amount of the drain, the discharge that came out. Uh, all that has to be done according to the facility's policy. Every facility has their own policy. So wherever you go, wherever you're working, make sure you have to know the policy. So when I'm done with that, I remove my gloves and then I wash my hands again. Hand hygiene is very important. After that, I have to again put on clean pair of gloves. If the drain side has dressing, I remove the old dressing and then apply a clean dressing. If the drain side is open to air and it has to still remain open to air, I just gently clean the sutures with a gauze pat dry and make sure it is dry, not moist. And after that procedure, I make sure I discard soiled supplies or linens, and then I also wash my hands. After washing my hands, I have to do documentation. Proper documentation is very important. I document the care according to what was done, what was requested, what was seen, and I have to check to see, to be sure that the documentation is accurate and is readable by all. So that is step I have to perform my care for drain. That's all for now. Thank you.